This is a review of some of the structures of the left hand. Approximately, we have the radial artery. This represents the tendon of the flexor carpi radialis, tendon of the palmaris longus, and the tendon of the flexor carpi ulnaris. This muscle deep to those tendons represents part of the flexor digitorum superficialis. Over here we have the median nerve. We have the ulnar nerve adjacent to the ulnar artery. This structure number 14 would come all the way across. It just cut so we could see the deeper structures. That's going to be the palmar carpal ligament. As we move down distally, we could see the tendon of the palmaris longus goes into the palmar aponeurosis. That's what this structure is here. And then going across distally by the metacarpal phalangeal joints, we have the superficial transverse metacarpal ligament. This muscle here represents the palmaris brevis. Remove this, we can see some of the deeper structures. Okay, so right here, number 24, which would go all the way across, it's just been partially cut, is the transverse carpal ligament, sometimes referred to as the flexor retinaculum. Here we have the 25 would represent the pisiform bone. Muscular-wise, we have the abductor pollicis brevis, flexor pollicis brevis, opponus pollicis. This is the adductor pollicis, abductor, AB, ductor digiti minimi, flexor digiti minimi. These would be the lumbricals. These tendons here represent the tendons for the flexor digitorum superficialis. The blood vessel going across here, this represents the superficial palmar arch artery, and then it gives rise to branches. Those are the common palmar digital arteries, and adjacent to those are the nerves, which are the common palmar digital nerves. As we move distal along those tendons, there's a connective tissue that's found by the metacarpal phalangeal joints, and that structure represents the fibrous digital sheaths, the annular part. Annular part goes transverse. As we move distally, this down here just shows on this one finger, this is the fibrous digital sheath cruciate part that goes over the interphalangeal joints. It crisscrosses. We remove that layer of tissues. We can see a couple of other things. Approximately, we could see part of the distal end of the radius and ulnar. Then we move part of the flexor digiti minimi, so we could see the opponus digiti minimi. This represents, these muscles here represents the palmar interossei. We can see part of the metacarpal bones of the hand. And then over here we could see deep to the tendons of the flexor digitorum superficialis, which represents these structures. We have number 47 here, which is a cut portion of the flexor digitorum profundus tendons. This structure here, number 34, this represents the dorsal interosseous muscle for the first digit. If we go ahead now and flip and look at the dorsal surface, approximately we could see the posterior surface of the distal part of the radius and ulnar. Over here, this is a vein. This is the basilic vein, the accessory cephalic vein, and then the cephalic vein. Coming across is the extensor retinaculum. This nerve here is a branch of the radial nerve, and this one over here is a branch of the ulnar nerve. These tendons are tendons of the extensor digitorum. The muscles that we can see here, that's going to be part of the dorsal interossei. If we look closely, we have a tendon that goes all the way across, heading towards the thumb. That's the extensor extensor pollicis longus tendon. Tendon of the extensor pollicis longus. Hallucis is for the big toe. And then we look over here, we have this tendon for the extensor digiti minimi. This muscle here is part of the abductor digiti minimi that I showed you on the palmar side. This here, just the posterior side of that particular muscle. And let's see, lastly, as we go along the digits, where we have the tendons of the extensor digitorum muscle, right here, this represents the central slip of the extensor digitorum, and then we have the collateral slips of the extensor digitorum. So those are the major structures of the hand.